Hi, my name is John Ferguson, and I would like to discuss deep vein thrombosis and pulmonary embolism prophylaxis. As surgeons, we are all well aware that one of the major causes of mortality in the postoperative patient are pulmonary embolisms related to deep vein thrombosis. There are some things that we can do that really reduce the risk. First and foremost, as with all things in medicine, it starts with a thorough history. We pay particular attention to both the familial and personal history of hypercoagulation. Medications are also important to look at, especially birth control pills in women. We ask that they cease the birth control pills 2 to 3 weeks before surgery and 2 to 3 weeks after surgery. A history of smoking is also extremely important in the prevention of deep vein thrombosis. We ask that our patients cease smoking 6 weeks before surgery and 6 weeks after surgery, sometimes even longer if there's some delayed wound healing. Now, there's some things that we can do intraoperatively to reduce the risk of deep vein thrombosis. All patients, and I don't care if it's a 30-minute breast augmentation or a 4-hour mommy makeover, have compression hose placed. I also ask them to keep them in place for at least 24 hours until I see them the next day. All patients that are under anesthesia also have sequential compression devices placed. For those procedures where the patient is awake, especially say a 12-hour hair transplantation, we get them off the table and ambulating at least once an hour. Postoperatively, we encourage ambulation as much as and as soon as possible postoperatively. The days of bed rest are over. It's also important to educate your patient in the signs and symptoms of deep vein thrombosis and pulmonary embolism, like chest pain and shortness of breath, and encourage them to contact me or their nearest emergency services as soon as possible. I hope you find this information useful. Thank you for your